Let's go over chest tubes today. For some reason, nursing school makes this such a complicated concept, but it's really not that difficult once you understand what each component of the chest tube does. So remember that the tube is inserted into the pleural space, so it allows air, blood, fluid to exit out of that area and the lung to reinflate. So this is pre-chest tube insertion, and post-tube insertion, you can see that the lung has reinflated. The tube's connected to a drainage system that uses gravity or sometimes suction that restores the negative pressure in the lung cavity. So firstly, we have the collection chamber. That is this entire area over here. This is going to collect with whatever fluid is inside the pleural space. And you can see that the collection chamber is right underneath the chest drain area that's coming from the patient. Let me move myself so I can point. This part here is coming from the patient and it's going to enter inside of the collection chamber over here. Next, we have the water seal chamber right over here. This is going to rise and fall, so it's going to fluctuate with inspiration and expiration. If there's no fluctuation, then the lung has reinflated or there's a kink in the tubing somewhere. Right beside that is the air leak monitor. And just think, if there's a ton of bubbling going on over here, that indicates an issue, so that indicates that there is an air leak. Patients who have a pneumothorax, so air in their pleural cavity, there may be some intermittent bubbling over here, and that is okay. And lastly, we have the suction control regulator over here. This is going to control the amount of suction coming from the wall. You can see that the suction control area is right underneath the suction port. So this part is the part that is going to be the tubing that's attached to the suction on the patient's wall. And in some cases like this one here, there is a wet suction. The other image showed you dry suction. With wet suction, it's the amount of water in this area, the suction chamber, that controls the amount of suction going on. When we have wet suction, so water is controlling the amount of suction, bubbling is okay over here. Bubbling indicates that the suction is working. And just friendly reminders not to kink your tubing and not to raise the actual chest tube system above the patient's chest because fluid can go back into the chest cavity.